With summer just around the corner, parents are once again thinking of how their children will spend the 3 months off school. Many opt to send their kids to summer sleepaway camps. This experience can be both exciting and fearful for children, especially kids who battle common medical conditions like asthma and uncontrolled bedwetting. 500,000 Canadian children ages 5 years and older wet their bed on a regular basis. A recent survey reveals that more than 50% of Canadian parents say that bedwetting is the most stressful condition, even more so than anxiety and obesity.
Camp is going to develop a child's life skills. They're going to make lifelong memories and friendships at camp that are going to help in careers and all kinds of things that kids are going to do for the rest of their lives. The challenge that some parents face if their children have medical conditions is really thinking that maybe camp isn't going to be welcoming to their children. The fact is that accredited camps across Canada work to make sure that camp is a great environment for all children and that medical conditions are dealt with in a very private and discreet manner and that all kids have the time of their lives at camp.
Dr. Norman Wolfish, a pediatric nephrologist from the Children's Hospital of Eastern Ontario in Ottawa, has been treating children for nocturnal enuresis or uncontrolled bedwetting for the last 42 years.
The first step in treating a child who wets the bed is to try and gain the child's confidence. These children have very poor self-esteem, and it's very important that they recognize that this is not their fault. The various kinds of treatments that have been approved by both the World Health Organization and the Canadian Pediatric Society consist of either the wet alarm or tablets called DDAVP. DDAVP is now available in a new formulation called the Melt, a very effective product, exactly the same as the body's messenger, and works in the same way, and that is reducing the total amount of urine that reaches the bladder. This is a small tablet that melts almost immediately in the mouth. This is important because the child does not require any water. It also may be very discreet, and this is very, very comfortable for the child if they have to go to a sleepover camp.
This year, nearly 52% of Canadian parents plan to send one or more of their children to sleepaway camp. 58% said that if there was a new treatment for bedwetting, they would likely have their child try it. For more information about bedwetting and available treatment options, parents are encouraged to speak with their child's pediatrician. Additional information can also be found online at medbroadcast.com/bedwetting. Sherry Demetarco reporting.